हेलो एवरीवन एंड वेलकम बैक टू माय प्लेलिस्ट ऑफ फार्माकोलॉजी जो हम मिनी कैटजिंग से कर रहे हैं। और आज का हमारा टॉपिक है सेरोटोनिन। सो हिस्टामिन हमने लास्ट टाइम किया था, वेरी इंपॉर्टेंट टॉपिक। एंड टुडे अगेन सेरोटोनिन नॉर्मल फिजियोलॉजी में इट प्लेज अ मेजर रोल। अभी हम देखेंगे कहाँ कहाँ मौजूद होता है। इट्स प्रेजेंट इन दी पूरा जो गट का एंटारिक नर्वस सिस्टम है उसमें ये एक मेजर प्लेयर है। और सिंस इट इज़ वेरी इंपॉर्टेंट इन कंट्रोलिंग अ लॉट ऑफ नॉर्मल बॉडीली फंक्शंस, इसके एगोनिस्ट और एंटागोनिस्ट also become very important. So let's start our discussion regarding serotonin, which is also called 5-hydroxytryptamine या 5-HT in short. Now serotonin is produced from the amino acid tryptophan and it is stored in vesicles in the enterochromaffin cells of the gut and neurons of the CNS and the enteric nervous system. You see, मैंने जब फिजियोलॉजी में एंटेरिक नर्वस सिस्टम कवर किया था तब ये बात डिटेल में डिस्कस हुई थी कि आपकी बॉडी में एक तो हम हमेशा कहते हैं देयर इज अ सेंट्रल नर्वस सिस्टम, देयर इज अ पेरिफेरल नर्वस सिस्टम एंड देन देयर इज एन एंटेरिक नर्वस सिस्टम। एक पूरा एंटायर नर्वस सिस्टम है, ओके, पूरा आपके गट में। तो वहाँ के न्यूरॉन्स में सेरोटोनिन इज वन ऑफ द मेजर प्लेयर्स. After release from these cells, it is metabolized by an oxidase which is known as monoamine oxidase. And excess production in the body, there are certain conditions. For example, carcinoid syndrome can be detected by measuring its metabolite, which is 5-hydroxyindole acetic acid, 5-HIAA. So ये तमाम स्टेप्स इंपॉर्टेंट है. सेरोटोनिन कौन से अमीनो एसिड से बनता है, किन सेल्स में स्टोर होता है और किस तरह मेटाबोलाइज होता है, और इंटरमीडिएटरी उसका प्रोडक्ट जो लेबोरेटरी डायग्नोसिस में यूज किया जाता है, यानी अगर 5-HIAA के लेवल्स हाई हैं तो इसका मतलब यह है कि देयर इज एक्सेस प्रोडक्शन ऑफ सेरोटोनिन इन द बॉडी, इसीलिए वो सेरोटोनिन मेटाबोलाइज होके ज्यादा अमाउंट्स में 5-HIAA बना रहा है. ओके, सेरोटोनिन प्लेज अ फिजियोलॉजिक रोल एज अ न्यूरोट्रांसमीटर सेंट्रल नर्वस सिस्टम में भी और गट के नर्वस सिस्टम में भी. ओके, एंड इट ऑल्सो एक्ट एज अ लोकली एक्टिंग हार्मोन जिससे GI एक्टिविटी कंट्रोल होती है. After release from the neurons, it is partially taken back into the nerve endings of the serotonin reuptake transport. These transporters are also important to understand. Now suppose this is the terminal nerve ending, or इस terminal nerve ending से serotonin release हुआ है. Serotonin can also be taken back by specific receptors back into the neuron, and those receptors are called serotonin reuptake transporters. Serotonin is also stored vesicles की फॉर्म में इन प्लेटलेट्स, लेकिन इसका प्लेटलेट में प्रेजेंस बहुत हाई लेवल्स की या बहुत ज़्यादा अमाउंट में नहीं होती. बट यू शुड नो दैट अपार्ट फ्रॉम द नर्वस सिस्टम इट इज़ ऑल्सो प्रेजेंट इन प्लेटलेट्स. In spite of the very large number of serotonin receptors, and more than 40 actually have been identified to date, most of the serotonin agonists, यानी वो ड्रग्स जो सेरोटोनिन की तरह काम करती हैं, ऑब्वियसली सेरोटोनिन जब रिलीज होगा तो वो सेल्स पे किसी न किसी रिसेप्टर पे जाके काम करेगा ना. तो ज़्यादातर जो एगोनिस्ट आइडेंटिफाई हुए हैं सेरोटोनिन के, they act on specific receptors and they are called 5-HT1DB, 5-HT2, 5-HT4 receptors. So ये तीन receptors आपको definitely पता होने चाहिए कि इन पर agonist किस तरह काम करते हैं. और जो serotonin antagonist है जो कि इस वक्त यूज हो रहे हैं, they are largely antagonizing the effects of serotonin at 5-HT2 and 5-HT3 receptors. तो you should know कि अगर serotonin की तरह काम करने वाले जो chemicals हैं which are what we call serotonin agonist, वो किन receptors पे काम करते हैं, these are the 3 receptors. and then जो antagonist हैं जो serotonin के action को block करते हैं, वो कौन से receptors पे काम करते हैं, 5-HT2 and 3. ओके, अच्छा जी, अब कुछ रिसेप्टर्स की हम बात कर लेते हैं. As I told you, there are so many receptors identified, but some of them which are of key importance will be discussed in this chapter here. The first one is 5-HT1. So if you see 5-HT1, D and B variants were being used by the agonists. So 5-HT1 receptors are most important in the brain and they mediate synaptic inhibition via increased potassium conduction. So synaptic inhibition is their job by hyperpolarization, increasing potassium conductance, and they are critically important in brain. तो ब्रेन में भी हैं, and there are peripheral 5-HT1 receptors as well. They mediate both excitatory as well as inhibitory effects using G-coupled protein system. So all this information बड़ी छोटी सी crisp information है, but it is all important. Then another serotonin receptor, 5-HT2 receptor, they are important both in the brain as well as in the peripheral tissues. These receptors mediate synaptic excitation in the CNS. So see, this is opposite to what HT1 was doing. It was doing synaptic inhibition in brain. But here, HT2 receptors are active honge, so they causes synaptic activity in the brain. Okay? Also in the smooth muscles. Gut mein, blood vessels में, uterus में, bronchi में, so muscle contraction. Several mechanisms. So देखिए ये सारी important information है. So यानी जब कभी आप serotonin agonist use करेंगे, agonist 5-HT2 receptor पे काम करता है, so contraction of uterus and all these things will happen. So इसलिए ये important information है कि so that you can align this with the clinical information. Several mechanisms are involved in 5-HT2 downstream mechanism, such as IP3 signaling, potassium conductance कम हो जाती है, cyclic AMP signaling reduce हो जाती है, IP3 basically increase होती है. This receptor probably mediates some of the vasodilation, diarrhea and bronchoconstriction. देखें डायरिया इसलिए क्योंकि GI मोटिलिटी बढ़ जाएगी, vasodilation इसलिए क्योंकि it will increase the size contraction of muscles हो रहा है, so at certain areas the size of the vessels will increase, bronchoconstriction, so that all depends upon the anatomy of the structure. कहीं पे particular muscles की contraction से dilatation हो सकती है, कहीं particular muscle की alignment अगर contract कर रही है तो वहाँ से specific anatomical structures contract हो सकते हैं. So all this information is important because once we talk about carcinoid tumor, now carcinoid tumor is something which secretes high levels of serotonin. So all these things will be very, very obvious and they are all basically the physiologic effects of serotonin. तो अगर आपको basic physiology पता है तो आप pathology and medicine के साथ उसको easily link कर सकते हैं. Okay? Now, in the CNS, 5-HT2C variant receptor mediate a reduction in the appetite as well. So that has also been used in the treatment for obesity. Not very successful because obesity is a multifaceted type of disorder, but still these drugs have been used in the treatment of obesity. Another category is the 5-HT3 receptors, which are found in CNS and also in the peripheral nerves, particularly enteric nerves and sensory nerves. These receptors mediate excitation via 5-HT gated cation channel. So all these are very important information. Okay, antiemetics basically इस category में fall करते हैं. 5-HT4 receptors are found in the GI tract and play a role in intestinal motility. So they are basically not being described to be present in the CNS. So 5-HT4 not in CNS, right, in GIT. Some clinical uses, serotonin has no clinical implication itself, यानी serotonin को as a drug use नहीं किया जाता, but there are some agonists, यानी ये जाकर के serotonin के receptor पर काम करेंगे serotonin ही की तरह. So ये जो receptor है इसको लगेगा वाह मेरे पास serotonin आया, लेकिन actually serotonin नहीं आएगा. तो अब receptor wise इसकी distribution बताई है. वो ड्रग्स जो 5-HT1 receptors पे काम कर रहे हैं, the 5-HT1 receptor agonists, example include sumatriptan. That's the prototype drug, and then so many other variants have been identified. Now, for example, naratriptan and other triptans, okay? They are the first line treatment for acute migraine because you know this is working in the CNS and cluster headache. So yes, clinical use hai. These drugs are active orally and also available for nasal formulation and parenteral administration. So this is the important bit for these drugs. Then 5-HT2 agonist, lorcaserin, it is approved for treatment in obesity. Okay, it activates the receptors in the CNS and appears to moderately reduce appetite. So इसका बहुत ही heavy use नहीं है, but still it is being used to moderate appetite. Okay, so obesity की treatment. पहले भी ये बात हमने यहाँ देखें की थी 5-HT2 receptor की discussion में. That's repeated again. So if you know the physiology, you understand how the drugs are going to work. Then HT4 partial agonist. Now HT4 आपको पता है कहाँ था? It was in the GI tract, GI modality. So इसका implication भी GI tract पे ही होगा. Example include tegaserod, relatively a newer drug, and it acts in the colon, GIT. It was approved and briefly marketed for use in chronic constipation because this receptor increases the GI motility. Okay, but later on it was found to be toxic, particularly for the cardiovascular system, and it's basically now stopped. Then selective serotonin reuptake inhibitors. Now when we talk about selective, ये हम agonist के साथ इसलिए use कर रहे हैं because there is a theory behind this. So let's try to understand. Suppose this is the nerve terminal and this is the cell जिस पर serotonin ने काम करना है. तो यहाँ से serotonin निकला 5-HT और इस रिसेप्टर पे आके उसने अपना एक्शन किया. अब मैंने आपको बताया कि considerable amount of serotonin is reuptaken by specific receptors which are called serotonin, which are selectively basically picking up serotonin. So selective serotonin reuptake receptors ना. तो अब ये जो receptors हैं, अगर मैं इन receptors को block कर दूं, then what will happen? If you block these receptors, तो ये serotonin reuptake नहीं होगा. As a result, the levels of serotonin will go high, and if the levels of serotonin will go high, तो serotonin का जो भी action इस receptor पे था वो भी increase हो जाएगा. So basically ये जो SSRIs हैं, ये direct agonists तो नहीं है इन receptors के, but because they are blocking the serotonin reuptake receptors, they are therefore increasing the levels of serotonin and hence the action of serotonin. Okay, and they are used clinically very commonly as antidepressants. इसमें पूरा chapter हम discuss करेंगे antidepressants पे, but that's the concept that you should understand. Now, what are hypothermic syndrome? Serotonin and drugs with agonist activity of serotonin effect sometimes associated with drugs in drug reactions including high fever, hyperthermia, skeletal muscle effects and cardiovascular abnormalities. So much so कि एक drug तो बंद कर दी थी इसकी वजह से, tegaserod. So side effects are common. It does not come without side effects. Okay, so if you look at this table 16.2, it gives you, we will come back to this table once we are also done with the antagonists. Okay, so up to what we have talked about is serotonin के basic receptors, उनकी distribution, and then what are the drugs which are acting on serotonin receptors as agonists. And now let us talk about what are the serotonin inhibitors, so antagonists. How do we classify them? Now, ketanserin, phenoxybenzamine, and cyproheptadine, they are effective 5-HT2 blockers. So they're very specific for this particular receptor. Then ondansetron, granisetron, dolasetron, and elocitron, they are 5-HT3 blockers. And ergot alkaloids are partial agonists at 5-HT, another receptor, but we will be primarily focusing on 5-HT2 and 5-HT3 blockers. Okay, so the ketanserin and cyproheptadine are competitive pharmacologic 5-HT2 antagonists. So this word, that's a long thing, but each and every word signifies something. So ये दोनों drugs, ketanserin and cyproheptadine, they are competitively binding to this receptor. So if this is the 5-HT2 receptor, these drugs will bind and serotonin will not be able to bind because it is competitively inhibiting it. So इसके competition में जाके यहाँ पे बैठ जाएगा and it will block the receptor. Okay, phenoxybenzamine is an irreversible blocker of the same receptor. So mechanisms are important. Then ketanserin, cyproheptadine, and phenoxybenzamine are poorly selective agents, although they work more on 5-HT2. So they are still not very good selective agents. Okay, in addition to inhibition of serotonin effects, now listen, they also go and act on some other receptors. So for example, H1 blockade, for example, alpha blockade. So these side effects have been reported. Ondansetron, granisetron, dolasetron, they are selective for 5-HT3. They block 5-HT3 as opposed to 5-HT2 receptors, and that's perhaps the only thing that you have to remember. Now you will have to reverse think about कि 5-HT receptor कहाँ use होगा, किस condition में इसकी implication होगी. So you have to go back to 5-HT3 receptor, think about anti-emetic. So यहाँ जितना discussion हमने किया था in the initial understanding of this receptor, antagonist भी उन्हीं clinical conditions के साथ associated होंगे. Okay, so clinically what we do is ketanserin is used as an antihypertensive drug, not in the US. Ketanserin, because there are better antihypertensive drugs. Cyproheptadine and phenoxybenzamine may be of value in the treatment of carcinoid tumor, because in carcinoid tumor we have a lot of serotonin. So these drugs will inhibit the effects of serotonin. Ondansetron and congeners are extremely useful in control of vomiting, so antiemetics, okay, which is particularly associated with cancer chemotherapy. So you particularly give these patients serotonin antagonist. They also come with side effects, और कुछ side effects तो मैंने आपको already बताया कि you are trying to block the effects of serotonin, but there is H1 blockade and alpha blockade as well. There can be other side effects such as GI side effects, diarrhea, headache, these sort of thing, and some more serious cardiovascular effects such as, disturbances in the QRS complex, QT prolongation, ECG abnormalities. So you have to monitor these patients as far as their cardiovascular profile is concerned. Very important to understand, okay? Now, there are some syndromes which are associated with serotonin, although we'll discuss this more in medicine lectures, but let's have a look very quickly. So for example, there is serotonin syndrome, and what drugs do you prescribe these patients are actually a long list of drugs. And how do these patients present is hyperthermia, hyperreflexia, clona. So actually I'll leave this for a medicine lecture, because then it will make more sense to understand these syndromes. इसकी पूरी हमें pathophysiology पहले पढ़नी पड़ेगी ताकि आपको ये सब बातें समझ में आए. So for now what I wanted to do is give you, confidence that you understand the gadgets associated with serotonin pharmacology, okay? So that's all about serotonin pharma. I will see you in another video very soon. Take care of yourself.